This video features the first level of a 7-level anterior hip replacement recovery workout program for mixed martial artists. I've been practicing martial arts of various styles, including MMA, since I was 15 years old. About 7 months ago, at the age of 41, I had a full anterior hip replacement with a dual mobility hip joint device. Since then, I've gone from barely being able to get out of bed to a more than 85% recovery of my pre-hip problem MMA abilities, and I'm still improving. I credit this largely to diligent physical therapy prescribed by professionals, coupled with a progressive MMA and strength training program that I put together myself. I'm not a doctor, physical therapist, or any other type of professional in this field. I'm just a guy who's practiced martial arts and fitness training for more than 25 years that has successfully recovered from my hip replacement. And I want to share my training program with anyone that's in a similar situation that's looking for a way to recover. You should review this program with your doctors before using it for your own recovery to make sure it's appropriate for you and make adjustments as necessary depending on any limitations you may have in your own situation. This first level of my program focuses exclusively on the initial recovery and physical therapy for the weeks immediately following your surgery. So it's very low intensity but high volume. I recommend you perform this level only once your doctor says it's okay to do so and until you've been cleared to move on to the next level, which will follow in a future video. Each of the 7 levels of this program will probably take about 1 month to complete based on my own experience, but it may be different for you, so don't overdo it. You can find a printable version of the workout in the video description. In terms of equipment, you'll need a pillow and either a bed, a carpet, couch, or a mat. The format is going to be, you're going to complete the workout twice a day, every day, or 7 days a week, performing each exercise for the designated number of reps and sets. Perform a single set of each of the standing lower body exercises, and for the remaining lower body exercises, perform them as a circuit, with a total of 3 sets for each. After all the lower body exercises, perform the assisted walking. If you can't perform the listed reps, perform only as many as you can initially, and work gradually towards full completion of the workout twice per day. Standing 2-leg heel and toe raises. Stand up straight, with or without support for balance, depending on your level of progress. Rise up on the balls of your feet and hold for a 1 to 3 count. Rock back onto your heels and lift your toes towards the ceiling, holding again for a count of 1 to 3. Continue for repetitions. Standing alternating butt kick. Stand up straight, with or without support for balance, depending on your level of progress. Contract a hamstring muscle and lift one heel towards your buttocks behind you, holding for a 3 count. Lower your foot back down to the floor and then repeat with the other leg. Continue alternating for repetitions. Standing alternating knee raise. Stand up straight, with or without support for balance, depending on your level of progress. Lift one knee up in front of you so that your thigh is parallel to the floor or higher, depending on your level of progress, and hold for a 3 count. Lower your foot back down to the floor and then repeat with the other leg. Continue alternating for repetitions. Lying 2-leg ankle pump. Lay down on your back on the floor, a bed, or a couch. Flex your calf muscles and point your toes downwards, holding for a 1 to 3 count. Then point your toes towards your face. Continue for repetitions to activate blood flow to your legs. Lying 2-leg flat quad contraction. Lay down on your back on the floor, a bed, or a couch. Contract your quadriceps muscles to straighten your legs and lift your heels off of the floor, holding for a 3 count. Relax your quads and let your legs lay back down on the floor. Continue for repetitions. Lying 2-leg glute contraction. Lay down on your back on the floor, a bed, or a couch. Contract your glute muscles, holding for a 3 count, then relax. Continue for repetitions. Lying 2-leg elevated quad contraction. Lay down on your back on the floor, a bed, or a couch, and place a pillow or other item under your legs to elevate your knees. Contract your quadriceps muscles to lift your feet up with legs out straight, holding for a 3 count. Relax your quads and slowly lower your feet back down to the floor. Continue for repetitions. Lying 2-leg heel slide. Lay down on your back on the floor, a bed, or a couch. Contract your hamstrings and slide your heels in towards your butt. Slide your heels back out and straighten your legs. Continue for repetitions. Lying single straight leg raise. Lay down on your back on the floor, a bed, or a couch. Keep both legs perfectly straight and raise one leg, holding your foot a few inches off the ground for a 3 count. Lower the leg back to the ground and relax. Complete the allotted repetitions on one side and then repeat the same number on the other side. As you progress in regaining strength, raise the leg higher off of the ground. If you found this video useful and you want to see more, please subscribe and hit the notification bell. We upload videos at least once a week. Thanks for watching.